Because there are several components to the huddle, all of which are important. So the first is that the medical assistant can start the day even before the huddle by doing what's called scrubbing the chart. And what this means is that he or she goes through the chart of every patient on the schedule for the day and looks for care gaps in the high priority items that the care team has established, and identifies care gaps that need to be closed during the visit for every single patient on the schedule. So for example, an example of a care gap might be evidence-based preventive care measures such as immunizations or cancer screening. Or the team may have decided on certain high priority chronic illnesses in which they're using evidence-based guidelines to close care gaps in patients with diabetes or hypertension or asthma or other diseases like that. So the actual huddle, who needs to be there? So first of all, obviously the provider who's providing the care, and anybody that he or she is sharing the care with. So this may be, in the most simple teams, it may be one or two medical assistants, but you could also be sharing the care with a person in the clinic who's providing services to more than one team, such as a dietitian, or a social worker or behavioral health person, or say, for example, a chronic illness nurse. The teams will differ in their composition based on the size and composition of the panel that they're taking care of. And you may have providers who share, two different providers who share a panel, for example. You might have a physician and a physician assistant working together, and if they're both in the clinic, then both should be at the huddle at the same time. But it's essentially everyone who is involved with the care of that panel. If the huddle, though, is too big and it's really two providers taking care of two different patient populations, then you need to split the huddle up, because the whole point of it is to get through it very efficiently. So the actual tasks that have to take place in the huddle when looking at each chart has to be fast. So the first thing that you're going to look for is there any missing information or that needs to be gathered up, such as the results of a referral, or maybe some test that was done outside the clinic since the last visit, or it may be a care transition that there needs to be a document from the emergency room. So any information that needs to be put together for that visit needs to be put down on a list that will, a task list for that patient. Obviously, the list of tasks for closing care gaps that the medical assistant put together prior to the huddle needs to be gone through and prioritized. Some things may need to be added, some things may need to be dropped. And then there will also be any other continuity issues for the patient. There may be equipment that needs to be in the room, such as an eye tray or liquid nitrogen. And so but those are essentially the tasks that need to be done for each patient. In addition to that, the team needs to be very clear how the medical assistant will prep the chart, will actually get the chart ready for the provider to make sure that all of the tasks discussed in the huddle actually take place. Because remember, the provider is extremely busy and is constantly being interrupted and having new things to think about with each visit. So the medical assistant may, for example, actually place orders and pen them in the chart. There may be components of the provider's template that a medical assistant can place into the chart note for the provider to act as a visual prompt to do the tasks that were agreed on in the huddle. And then the last part of the huddle is to simply look for where there is some flexibility. In other words, to identify the places in the schedule where there will be, the team will be extremely busy and may have to drop some of the tasks simply to stay on schedule, or there may be some visits in which there will be some slack, and if there needs to be a patient added into the schedule, that they can agree on the best time to do that. In summarizing, I'd like to make a few points that are important. First is to keep the huddle short. It needs to be no more than 10 minutes in length. Secondly, start small. There's no reason to do this all at once. It's not necessary to have the medical assistant scrub the chart immediately. They can do that after the team has had a huddle for several months and they really get the hang of it. In addition to that, it's important to identify the strengths and weaknesses of the team members, and the provider can learn how to delegate the strength and to teach the weakness. And finally, don't boil the ocean. I mean, if there's too many tasks to do on any individual patient, just do one or two each time the patient is roomed. The point is to stay on schedule and move things along, and over the weeks and months that the team is working, the care outcomes will start to improve, and the tasks that need to be done on every single patient when they come in get fewer and fewer.